know what she said. She might just change your life.
Sharon Caddy and Kate Wheeler with you in studio today, and joining us now is Jane Virro, who is the Executive Director of VictoriaAngel. Now that is, it's a public cord blood bank, right?
That's right.
So explain what the difference is between a public cord blood bank and a private one.
Okay. When a baby is born and they cut the umbilical cord, that umbilical cord is very precious, and parents have a choice to do three things. They can have that umbilical cord go into the garbage, which we don't want them to do, or they can donate it to a public cord blood bank where we extract the stem cells, we freeze them, and we make them available around the world for people to use for treatment of cancer, specifically leukemia, lymphoma, and 80 other diseases actually. Or they can decide to store it for their own family, which is called family banking, in which case they pay a fee. It's about $1,000 up front and $125 a year. And those cells are stored on their behalf at the lab, and they have access to those cells should anybody in their family need them.
Now, what is it, when we talk about cord blood and stem cells, what is it that's so special about the blood in an umbilical cord that has this power in healing?
It's a really good question, because those stem cells are actually life-saving. If you've heard of people on the news that need bone marrow transplants because they've had leukemia or they've had radiation and chemotherapy that's damaged their bone marrow, they need a stem cell transplant. And you can get a stem cell transplant from a bone marrow donor or from umbilical cord blood. The thing with a bone marrow donor is you need an exact match between the person that's sick and the person that's donating. And for some people, especially those of minority groups or people with mixed cultural backgrounds, that exact match is very, very, very hard to find. Cord blood allows you to, they're very infantile cells, so you don't need that exact match. So it helps people find the treatment that they need.
Now, there's been a lot of debate among doctors, how do you say that? Academicians? The academics of the world, about whether or not the science is up to speed, and perhaps private cord blood banking, it was being disparaged as people saying, well, the science isn't there, you're never going to use it. If anybody's going to do cord blood banking, it should go into the public domain. What kind of percentages are you seeing now of people that are choosing to bank privately as opposed to giving it to a charity where it would be accessible to everybody?
Well, unfortunately, the percentages of cord blood going in the garbage is the greatest. And of the ones that are being donated in Canada, it's very difficult because there are few places to donate it. So if you want to have cord blood access, then really your only option in Canada is looking outside of Canada in the international public banks or storing it for yourself. Now, one of the things that you said, Kate, was about the science being behind, but it really isn't the science that's behind. Cord blood is being used thousands and thousands of times around the world. That's not what the disparaging comments might be about. It actually has fewer side effects and graft problems than bone marrow because of the infantile state of the cells. And it actually is treatment of choice for a lot of diseases such as Hurler's and Krabbe's and other diseases.
So is it a communication and education problem that we're facing?
I think it comes down to the choice of, should people pay for something that they might not ever use? It's kind of like insurance. Now, having just had a cottage burn down last year, I know that things can happen that you don't ever expect, and I was very glad I had that insurance. Of the children and the families that have used their stored cord blood, it was priceless. I'm sure they were happy they spent the money. Of the ones that still can't find any cord blood, can't find that match, like little Sarah Watkin, who lived in Thornhill, 7 years old, died because she couldn't find a match. It makes you wonder why more people don't donate it. If you can't afford it and you don't want to store it for your family, then just donate it. It's free of charge. It's free of risk. It's easy to do. We work with 30 hospitals in the GTA. We make it simple.
So if I'm pregnant and I'm about to give birth, how would I find out whether or not I have a hospital that's going to come and collect it? And
Well, right now we work with pretty well every hospital in the GTA area, from Brantford to Kitchener to Newmarket to Oshawa and down to the lake. But you can always go to our website to find out what the criteria are for donating. Right now, of course, with Zika virus, there's a new little edit that we had to make, because if you've traveled to South America and some of the Zika virus states, then you can't donate. So there's some interesting information at VictoriaAngel.org.
okay, so with the Victoria Angel Registry of Hope, something groundbreaking has happened, and that's why we called you in, because we really want to understand how this came about. The cord blood of a baby stored here is helping save the life of a man in the United Kingdom, in England.
Yes. I know, it gives me just
Isn't that amazing?
goosebumps when I think of it.
How did that happen? How does that happen? Because this is what you want to explain to people, that it's verging on miraculous science, that a baby here can save the life of a man there. How does that happen?
It's amazing. It happens, and it starts with the parents. The parents decided of this little baby when they were pregnant that they wanted to donate their baby's cord blood. They filled out the forms, got their kit, took it to the delivery. The doctor collected a beautiful big sample with lots and lots of beautiful stem cells in it. We froze that sample, we tissue typed it, and we posted the information about the sample at a registry in the Netherlands. The doctor in the UK who was treating his patient was looking everywhere for a stem cell transplant sample, went to the Netherlands and submitted his patient's tissue type, and lo and behold, there was a sample from Victoria Angel in Toronto that could help his patient or her patient. So we were contacted from the hospital and said we need that cord blood unit, and within 2 weeks we had the frozen sample shipped over to the UK, and he has received his transplant already. This all happened in the matter of 3 weeks. He's received the transplant, and now we're waiting to see if those little baby stem cells have engrafted in his bone marrow.
Now, engrafted, explain it, because this is something that different companies, different organizations have different success rates with. What's the difference?
Well, engraftment really is that the new cells start to work at the bone marrow level in the new patient. So they start to form all the parts of the blood, the white cells, the red cells, the plasma, the platelets. Everything is started to form from the bone marrow. You have to have healthy bone marrow. And these new cells, to engraft, means that they start to make the blood products in the new person who received it. Yeah.
So the science is working.
The science absolutely is working.
So the science is working, and this is, and now a cord blood sample is not inexpensive. They're more than $40,000. So when a hospital goes looking for that, that's something that the hospital covers in costs, right? So this this could actually prove to be a more cost-effective way for hospitals to help their patients.
Usually it's insurance companies, or in our case, OHIP would cover the cost of the bone marrow or the stem cell unit. And yes, you're right, it ranges anywhere from kind of $30,000 to $55,000 around the world for one single cord blood unit.
So if you're spending that kind of money, or even if you're an insurance company, you want to know that it's going to be a good match.
Yes, that's true.
But does it help reduce costs for, you said this doctor in the UK had registered on a site in the Netherlands. So he's looking anywhere.
Yes.
Because then they don't have to, when we've all seen people, pleading for bone marrow donors to come forward. So doing all that kind of testing for somebody that's a perfect match, that obviously costs money for an organization or a hospital that's putting people through it. So in the end, do you think that the costs can come down to make it more cost effective if more people are using this?
I think if more people are using it, absolutely. Absolutely. The other thing to remember, too, is all of that time that it takes to find that bone marrow match, to get out in the public, to do the swabbing clinics, even to be looking for stem cell donors at different registries, that takes time. The whole time that's happening, the patient is getting sicker. And your chances of a good recovery happen better if you have your stem cell transplant earlier rather than later. So the fact that cord blood is readily available, frozen, and we can send it out in 2 weeks makes a huge difference to the overall health of the transplant patient.
And we are back in studio, Kate Wheeler and Sharon Caddy with you today, and we're talking with Jane Virro, who's the executive director of VictoriaAngel, about their groundbreaking success, groundbreaking for Canada, in sending the cord blood sample from a baby here to the United Kingdom, where it is being used to literally save a man's life. What kind of buzz does that give you?
That's what we've been working for.
Yeah, and you do. You smile. I mean, you're so excited. This is what we've been working for. I mean, when you got that call, what went through your mind?
I can't even explain it. It is the best feeling that you could ever have. And, you know, it's just not just me. It's all the people that have supported us over the years financially, all of our volunteers, our scientific director. There's so many people that have made this happen, and it's what we've been working for. I just can't even tell you how wonderful.
Now, for people that make cord blood donations, what kind of miracles can be done? What kind of diseases can be treated with stem cells?
Well, it's very interesting. There's a lot of diseases that might affect different groups that people will relate to. Of course, leukemia, which is the most common childhood cancer. It's almost 50% of all childhood cancers. And it affects kids between 2 and 7 years old, you know. And it's also becoming more prevalent in the 19 to 35-year-olds. But there's also thalassemia, which affects a lot of the Mediterranean population. And in fact, my dentist has a little nephew who was born with an immune problem, a very rare disease, and cord blood can treat this little guy as well. We hear more and more stories about it. There's some great work being done in the States. Kate, you had said what's on the radar, and we're really excited about the work that's being done with brain injury. Cerebral palsy, we've seen it at the conferences that this data is coming out, that it's so promising, and they're actually starting to slow down the studies because the work has been so promising already, that children with cerebral palsy or who are born with some brain damage can receive their own stem cells, and it really helps the brain to repair itself. And they're saying now that, you know, head injuries from motorcycle accidents or other things should be the next area of study because the mechanism of brain injury is very similar. And perhaps these stem cells could help in that case as well.
It's interesting because we're seeing, it's amazing what the body can do, because we see athletes being treated with this PRP treatment where they're injecting, or not injecting, using microneedling to take your part of your own blood, I guess, and treat injuries on the sidelines at games. And you're talking about something that we have that for the most part is being thrown into the garbage that could, I mean, how many samples can you get from one cord blood?
You can get one sample.
One sample.
Yes.
Cord.
Now, in the case of the cerebral palsy, what they're looking at is using multiple samples out of the one sample for the treatment. But for the case of this gentleman in the UK, he received one transplant of that baby's stem cells, which was just done through a intravenous line and took maybe 15-20 minutes.
You can see the smile on her face. She's like, "We did this. we did this." And this is what is so cool about it. So I mean, the other diseases, and you were explaining before that with people, we don't even call it intermarrying anymore, but as we see more children born of a combination of different races, and it just goes backwards and backwards and backwards, that you might, if that child has a problem, has a medical issue,
Right.
there's hardly like anybody maybe that they know that matches that genetic makeup.
Exactly.
But in the world of the cord blood storage, you have better chance of finding someone.
Exactly. Because you don't need that perfect match with cord blood.
Right. It can. It sort of adapts a little
Exactly.
bit more.
Perfect.
It's adaptable. So why don't all hospitals collect as a matter of course?
Well, I think that it's really a money issue.
Okay.
Canadian Blood Services has a public cord blood program. They work with a hospital in Ottawa, in Brampton, in Edmonton, and in Vancouver. We've chosen to have a program that allows more hospitals access to the public cord blood bank, and to the parents as well. And I guess the biggest message is that, let's say if you're pregnant, you have so many things to look at when you're pregnant. But I'd really like anybody out there listening who knows somebody who's pregnant or is pregnant themselves to just look at our website if you're living in Toronto. Really, to save a life, if you think about it, you don't need to be jumping into burning buildings. You don't need to be dragging people out of the ocean. You can sit in your home, fill out 4 forms, send them in to us, and make a phone call after you've delivered your baby. That's pretty well it. And you can help save a life. So I just don't understand why more people don't.
Don't do it.
And your program and your listeners will now know about it. Maybe they just need to know.
And we need to spread the word. And this is what she said on Sirius XM 167, Canada Talks, as we're chatting with Jane Virro, Executive Director of VictoriaAngel. So how long now have you had VictoriaAngel going, and how much have you been able to do?
Well, we've had charitable status for 3 years now. And over the entire time of VictoriaAngel, we've had about maybe 2,000 applicants. And out of those, we don't store every sample. People need to know that if they donate it, it might not be there should they need it. So, and in most cases, it's not. Because we have to take the biggest and the biggest samples that are most likely to treat as many people as possible. So,
but you are committed to releasing samples free of charge to Canadians in need if they're the right match.
Well, that's an interesting thing. We had said at the beginning that we were committed to releasing samples free of charge if they're a match. And all the transplant docs that we spoke to in Canada said, no, Jane, you can't do that. You can't do that. People will perceive that they're less value or they're less quality than the other cord blood banks that are charging $40,000 and $50,000. So we had a real ethical dilemma. And what we've come up with is if there's somebody in need that absolutely needs a cord blood sample and there isn't any way of paying, for sure, we would never hold it back from them. But as a cost recovery program, we would charge for some of those samples.
So, okay, so I mean that seems fair. I mean everybody has to keep it, and there is a cost to storing it.
There's an enormous cost, yes.
And to doing it. Now, there seems to be a trend, I don't know if it's continuing, in something called delayed cord blood cutting, where people think that they're getting more vitamins in the system. Does that, if you delay the cord blood cutting, does that affect the sample?
It does. Those people that wish to delay their cord clamping until 2 minutes or till the cord stops pulsing, we wouldn't be able to collect those samples for medical use. We could use those for research. But if you're planning on cutting the cord within a minute or less after the baby's born, then we can still collect that sample, and there may be enough stem cells in it for us to store it for medical use.
So why does it change so dramatically?
Because the blood just keeps circulating through the baby and through the cord, and things start to coagulate.
Okay, so we don't want that one. All right, so then, and as far as you understand, medically there really is no purpose to delaying it. I mean, some people say you get more iron, but I would think that if the baby's been living off that umbilical cord placenta for 9 months, there a minute isn't going to make that much difference in the iron that's in their system, is it?
Well, they say that the recommendation is if it's a premature baby, yes, that delayed clamping can make a difference to premature babies. But any child that has really good prenatal health, if the mother has good prenatal health and it's a full-term baby and the baby is healthy at birth, it's still out whether or not that delayed clamping is going to make any difference.
So clamp it quickly and donate it.
I will never say that.
I can't. Well, no, because I think, we're the age where, a lot of our listeners have children who are getting pregnant, or they're going to be. Now, what a nice thing, to mention to your daughter if she's unaware from it. It's nothing, and you're starting off this new life in a charitable way.
Yes.
That they're the first thing they've done, just by being born, they're doing something good for the world.
That's a special gift. Again, goosebumps.
Again, goosebumps. Okay, so now tell people what your website is, because they can. There's lots of questions that people may have about how this can be a life-saving treatment, something you can keep within your family, or something you can donate to the world.
Yes. You can donate cord blood, and we're always looking for financial donations as well. The more financial donations we receive, the more cord blood we can collect, the more lives we can save. So it's VictoriaAngel.org.
And like you said, if you know someone who's pregnant, just pass that along.
Pass it along, please.
It's such a simple thing to do to make such a big difference in someone's life.
Didn't have it when our children were born.
I remember hearing about it when
It was just coming in.
and it was wow, it was prohibitively expensive back then.
Yeah.
Boy, we've come a long way in 20 years.
Jane Virro, thank you very much, and congratulations. Way to go.
Thank
Way to
you.
go.
Thank you, ladies.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.